Good morning, I'm Dr. Kerry Chant from New South Wales Health with the COVID update for Tuesday the 7th of December 2021. There were 260 cases of COVID reported in New South Wales in the 24 hours to 8 p.m. last night, and there were more than 58,000 COVID tests reported during that period. There was now a total of 31 cases of COVID with the Omicron variant in New South Wales, and 11 of these cases were acquired either overseas or on an international flight, and the other 20 cases were locally acquired and are all linked to the ongoing Regent's Park Omicron cluster. The source of this cluster is believed to be a returned overseas traveller who arrived in Sydney from Doha on flight QR908 on the 23rd of November. This person had spent time in Nigeria, and it's expected that the numbers linked to this cluster will rise as further results are confirmed over coming days. To date, there have been no cases with the Omicron variant admitted to hospital for COVID-related care, and we're keeping a close eye on that situation. Currently, we have 155 COVID cases admitted to hospital, with 28 people in intensive care, 5 of whom require ventilation. Across New South Wales, we have 94.7% of people aged 16 and over have received their first dose of a COVID vaccine, and 92.8% are fully vaccinated. Of the people aged 12 to 15 years, we've got 81.3% have received a first dose, and 77.2% are fully vaccinated. And again, I urge parents to take this opportunity as school is breaking up to get your children booked in for a vaccine for those 12 to 15-year-olds. We would like to see that coverage as high as possible. Sadly, New South Wales Health is reporting the deaths of 2 people. A woman in her 90s from Western Sydney died at Westmead Hospital, and she was a resident of the Blacktown Terrace Care Community Aged Care Facility where she acquired her infection, and she had received 2 doses of a COVID vaccine and had underlying health conditions. This is the first death linked to an outbreak at this facility. We also have a gentleman in his 90s from southwestern Sydney who died at Liverpool Hospital, and he was not vaccinated and had underlying health conditions. I'd like to express my sincere condolences to the families for their loss. New South Wales Health is continuing to investigate the outbreak of COVID cases associated with the Omicron variant at Regent's Park Christian School, Sydney Indoor Climbing Gym in Villawood, and the St Peter Chanel Catholic Primary School in Regent's Park. There's now 20 cases confirmed as being Omicron variant linked to these venues, in addition to a confirmed case in the ACT, who likely acquired the infection at the climbing gym. The ACT has also reported further transmission linked to this case. I'd like to express my gratitude to the school communities linked to this outbreak for their cooperation in rapidly presenting for testing and isolating and following the public health advice. New South Wales Health continues to work with the community to keep COVID transmission as low as possible as we learn to live with the virus. We are working also with our international counterparts to rapidly gain a better understanding about the nature of the new variant. So this includes understanding how easily it's spread, how transmissible it is compared to the other variants. We're also working to understand the severity of the variant and, importantly, how effective the vaccines are at offering protection against severe disease, but also how they impact on transmission or how easily it's spread. Whilst we are part of this global effort to better understand Omicron, we are also responding to Delta cases in New South Wales. The New South Wales community has done a phenomenal job in keeping us safe, keeping each other safe throughout the pandemic. And I'd like to just urge us to continue to take those simple measures to keep yourself and others safe, particularly at this time of year when we know we're catching up more with friends and family, and often elderly relatives and family members. It is important that we wear a mask when we're in indoor settings, that we don't go out anywhere if we've got the most mildest of symptoms. Instead, get a test. Also, if you're choosing safer environments, choose outdoor environments, outdoor seated or well-ventilated spaces. And especially my key message is we need to keep coming forward for testing. So even with those milder symptoms, isolate until you have received a negative result. These simple practices will keep you and your loved ones safe. Also, whilst we're approaching that 95% double vaccination rate, albeit inch by inch, we still have the opportunity for a number of people to continue to get vaccinated. And so please, I urge everyone who has not yet availed themselves of the vaccine to do so. If you've got concerns, please reach out to your pharmacist or GP and talk those concerns through. We now have a lot of international experience around the safety of the vaccines, so please engage with your GP or pharmacist or go to one of the government websites for more information.